Did you know that about 6 to 8 lakh people die of sudden cardiac deaths annually in India, and most of them are below 50 years of age? Sudden cardiac deaths can happen to anyone regardless of your age, gender, your fitness level or your heart condition. Hi, I'm Dr. Lakshmi and you're watching Yashoda Hospitals, the Health Talk session where all your health related queries are answered here. So let's know more about sudden cardiac death in our today's episode. Joining our discussion today is Dr. Sowjanya, Head of Emergency Department from Yashoda Hospitals, High-Tech City. Welcome to the show, Dr. Sowjanya.
Hi, thank you.
So according to recent surveys, sudden cardiac death or sudden cardiac arrest is on rise irrespective of your age or gender. So to begin with, what exactly is sudden cardiac death, doctor?
Sudden cardiac arrest is a sudden cessation of a cardiac activity. So if we look at our heart, we have both electrical and mechanical activities. So any disturbance in the electrical activity is called as a sudden cardiac arrest. So we are seeing a lot of people getting affected with sudden cardiac arrest, and which is on rise now. And as per the statistics, around 17.8 million people are affected every year with cardiac diseases. And countries like United States, where there is a huge knowledge about basic life support, they get 1,000 deaths per day for sudden cardiac deaths are recorded. So that is the impact that we are seeing. And when it comes to India, we don't have exact statistics, but with the rise of cardiovascular diseases, our numbers are also equally high for sudden cardiac deaths.
So చాలా మంది heart attack and sudden cardiac death అంటే ఒకటే అనుకుంటారు. So what exactly is the difference between heart attack and sudden cardiac arrest, doctor?
సడన్ కార్డియాక్ అరెస్ట్ అంటే ఎలక్ట్రికల్ యాక్టివిటీలో వచ్చే చేంజెస్ వలన హార్ట్ అనేది సడన్గా స్టాప్ అయిపోవటాన్ని మనం సడన్ కార్డియాక్ అరెస్ట్ అంటాము. హార్ట్ అటాక్ అంటే మన గుండెకి సంబంధించిన బ్లడ్ వెజల్స్ ఉంటాయి, అవి బ్లాక్ అవటం వలన కొంత అమౌంట్ ఆఫ్ హార్ట్ మజిల్ అనేది ఎఫెక్ట్ అవుతుంది, దాన్ని హార్ట్ అటాక్ అంటాము. సో హార్ట్ అటాక్ వచ్చిన వాళ్ళలో 60 to 70% ఆఫ్ ద టైమ్స్ హాస్పిటల్కి టైంకి తీసుకురావటం వలన డెఫినెట్గా వీళ్ళని సేవ్ చేయడానికి అవకాశం ఉంటుంది. సడన్ కార్డియాక్ అరెస్ట్తో ఏంటంటే అవుట్ ఆఫ్ హాస్పిటల్ సడన్ కార్డియాక్ అరెస్ట్ అయిన పేషెంట్స్ని హాస్పిటల్లో తీసుకొచ్చిన తర్వాత డిశ్చార్జ్ వరకు చూస్తే less than 5% ఈజ్ అవర్ సర్వైవల్ రేట్. ఇన్ హాస్పిటల్ అరౌండ్ 7% ఈజ్ ద సర్వైవల్ రేట్. సో there is a huge difference between sudden cardiac arrest and heart attacks.
So most of us are aware about symptoms of heart attack, that is chest pain or difficulty in breathing. What are the symptoms for sudden cardiac arrest, doctor?
Nomenclature of it, sudden cardiac arrest is not sudden as such. So a study has been done in Poland for 839 individuals లో ఒక స్టడీ చేశారు. సో దానిలో ఏంటంటే 50% ఆఫ్ దీస్ ఇండివిజువల్స్ హ్యావ్ సిమ్టమ్స్ అప్ టు 4 weeks బిఫోర్ ద ఈవెంట్, అండ్ 80% ఆఫ్ ద ఇండివిజువల్స్లో సిమ్టమ్స్ ఆర్ దేర్ విత్ ఇన్ ఫ్యూ డేస్, అండ్ 90% ఆఫ్ దెమ్ హ్యావ్ డెఫినెట్లీ సిమ్టమ్స్ అప్ టు 24 hours. సో సిమ్టమ్స్ ఏంటి అంటే ద మోస్ట్ రికగ్నైజ్ సిమ్టమ్స్ చెస్ట్ పెయిన్, షార్ట్నెస్ ఆఫ్ బ్రెత్, palpitations, syncope, abdominal pain and flu-like symptoms are the common symptoms that are recognized in these patients. And it is also noted that chest pain is commonly seen in men and shortness of breath is commonly seen in women.
And most of us think that sudden cardiac arrest can happen only to adults. So do you think this is true?
Not exactly. Even children with lot of channelopathies or mitochondrial diseases are also getting affected with sudden cardiac deaths. So they will have something called as tachybrady syndromes and a lot of electrical disturbances which leads to arrhythmia in kids are prone for sudden cardiac deaths while they are playing or having high intense activities. They will have this kind of sudden cardiac deaths.
So if a person is having sudden cardiac arrest, doctor, what steps can a bystander take to save his life?
So when we recognize sudden cardiac arrest, first and foremost is called as chain of survival. and early compressions and early defibrillation. So these are the three things that has to be implemented in these people, and we call this as a basic life support. So this is the initial treatment till they get advanced life support. So as soon as we recognize patient is unconscious, pulse ledu ante, first and foremost is starting chest compressions in these people, and continue these chest compressions till an AED is available or advanced life support comes there.
So discussing about basic life support, doctor, who all can perform this and how?
Basic life support can be done by any individual who is knowledgeable to do compressions. And lot of Western countries lo 6th standard onwards, basic life support training is part of their curriculum. So they teach to all school going children, teachers, college students, all adults, those who are in public service activities, police personnel, all will be taught about basic life support, and that is important to save these lives. So chest compressions anta earlyga start cheste anta survival rate ni manam penchochu. At the same time, lot of public areas have AEDs available, which will help in giving early defibrillatory shock ivvadaniki use ayye AEDs available on airports, railway stations, malls, all will have these AEDs. And these are very easy to use AEDs. Even a layman can use them. How to connect the paddles and analyze the rhythm is done by the machine itself, and it will advise whether shock is needed or not. And these only 3 to 4 steps anybody can use it, and the available cheyadam valla the sudden cardiac arrest vachina situations lo we can save the victims at the earliest.
So we've discussed earlier that sudden cardiac deaths are on rise irrespective of age or gender or your fitness levels. So what do you think the causes for this could be, and what preventive measures one can take up?
మనం అనుకున్నట్టుగానే సడన్ కార్డియాక్ అరెస్ట్ ఈజ్ బికాస్ ఆఫ్ ఎలక్ట్రికల్ డిస్టర్బెన్సెస్ ఇన్ ద హార్ట్, అండ్ రికగ్నైజింగ్ దీస్ ఎలక్ట్రికల్ డిస్టర్బెన్సెస్ ఈజ్ వన్ అండ్ ఫోర్మోస్ట్ ఇంపార్టెంట్ థింగ్. So we have measures like ECG, which will record electrical activity of the heart. Sometimes ECG is a resting ECG antamu. So 10 seconds of the time heart lo jarugutunna activity ni maatrame ECG telijegalutadi. So there are other things called continuous ECG monitoring, which will quantify the disturbances and help us to identify if the patient is going to be at risk for sudden cardiac arrest. And there are a lot of advances are happening with the help of artificial intelligence, machine learning. Algorithms are being made to predict sudden cardiac deaths in the population. So ECG monitoring, continuous ECG monitoring lo there are certain parameters in teeskuni algorithms have been made to predict sudden cardiac death as well. And in general, what is required for public is getting regular health checks and identify if they are at risk for sudden cardiac death. 2, lifestyle modifications and having a regular exercise, healthy diet, and stopping excess alcohol intake and smoking. These are all the notifiable risk factors patients can have. వీటన్నిటిని modulate చేసుకుంటా we can avoid sudden cardiac death as much as possible.
So before we wrap this episode, Dr. Sowjanya, is there any message that you would like to share with our audience out there?
The first and foremost message is to understand that sudden cardiac arrest is not sudden. Regular health checks and not ignoring subtle signs like chest pains, palpitations, we can always avoid or prevent sudden cardiac deaths. And knowledge about basic life support is very, very useful in case of any event of sudden cardiac arrest happening in the family.
So thank you, Dr. Sowjanya. It was wonderful having you here on the episode today.
Thank you.
So this brings us to the end of this episode. Remember, sudden cardiac attacks can happen to anyone irrespective of your age, gender, your fitness levels, and your present heart condition. Getting regularly screened is very important, and do join us for next week as well. Until then, take care and stay healthy. Thank you.